Welcome to the Doctoring 1 HEENT cluster exam. The HEENT exam differs from the previously learned cluster exams because it is a body area exam incorporating elements of multiple organ systems and requires special tools, the otoscope and ophthalmoscope, as part of the exam. Also notable is that the order of the HEENT exam can be performed in several ways. Some clinicians prefer to incorporate the special tools as they move through the exam, while other clinicians prefer to wait until the end before performing exams requiring the special tools. In this video, we will demonstrate the latter. After washing your hands, start by inspecting the scalp. As you can see, for most patients, observing the scalp requires the examiner to comb through the hair for proper inspection. Observe the scalp for any rashes or masses. Next, palpate the scalp with both hands, feeling for any tenderness or bumps. Next, we're going to inspect and palpate the ear, including the auricle, lobule, and tragus, and observe for any rashes or abnormal bumps or tenderness. Next, we're going to palpate the frontal and maxillary sinuses. This is done by pressing up on the frontal bone from under the medial brow for the frontal sinus and pressing on the maxilla for the maxillary sinus. Next, we're going to observe the nose for any deformity or deviation from midline, and then palpate the nose from the bony bridge of the nose to the cartilaginous tip for any tenderness. To palpate the TMJ, place the index fingers just in front of the tragus of the ear, here marked with an X, and ask the patient to open his mouth. Your fingertips should drop into the joint space as the mouth opens. Note any tenderness or crepitus as you ask the patient to open, close, as well as move the jaw side to side and forward to back. Next, we're going to examine the neck, starting with the lymph nodes of the head and neck. These are the same lymph nodes examined as part of the core exam. Inspect the neck for symmetry, and then palpate the trachea and the space between the trachea and the sternomastoid muscles for any tenderness or masses. We're going to conclude the neck exam by palpating the thyroid gland. This can be done through the anterior or posterior approach. Here I'm demonstrating the posterior approach. First, feel the thyroid cartilage, which is prominent in most people. Below it, palpate the cricoid cartilage. Place the fingers of both hands below the cricoid cartilage, along the tracheal rings, and ask the patient to swallow. Try to feel the thyroid gland as it slips under your fingers. Next, check visual acuity. This is the same exam that we learned as part of the neurologic cluster exam. Using the handheld visual acuity card, ask the patient to hold the card at a distance specified on the card and cover one eye. Ask the patient to read the smallest line of print possible and note the line where the patient was able to identify at least half the letters correctly. Document the visual acuity for each eye. The inspection of the eye is the same exam as we did in the core exam. This includes visualization of the scleroconjunctiva. As well as assessing for pupillary reflex both direct and consensual. While not demonstrated here, the HEENT cluster exam also includes extraocular movements. Please review the neurologic cluster exam for a demonstration of this exam technique. Now we're going to demonstrate using the otoscope to visualize the ear canal. After attaching the ear speculum to the otoscope, hold the otoscope like a pencil, using the thumb, index, and middle fingers to hold the otoscope while using the pinky to brace the hand gently against the patient's face. This allows for greater control and makes it less likely that you'll accidentally poke the patient if they move. Next, pull up and back on the patient's auricle with a non-dominant hand as you gently insert the speculum into the canal. Inspect the canal for any cerumen, foreign bodies, or discharge. As you insert the speculum further, you should observe the tympanic membrane, including the cone of light and the malleus. Repeat with the other ear. For the internal inspection of the nose, we will again be using the otoscope. After replacing the speculum tip, hold the otoscope horizontally using the same grip. Have the patient tilt his head back slightly and insert the speculum directed posteriorly to observe the septum and lower turbinate. Then tilt the speculum upward to observe the septum and the middle turbinate. Be careful to avoid touching the sensitive nasal septum. Repeat with the other nostril. Of note, asking the patient to breathe out of his mouth instead of his nose during this exam can help avoid fogging up the otoscope. The oral pharynx exam is the same exam as we demonstrated in the core exam. Again, be sure to use a light source and a tongue blade for this exam. Use a tongue blade to push against the buccal mucosa bilaterally and observe the gums and the buccal mucosa. Then use a tongue blade to push down on the tongue to better visualize the symmetric rise of the uvula, the tonsils if they're there, and the posterior pharynx. Finally, have the patient lift the tongue. Our final exam is the fundoscopic exam. For this, we'll be using the ophthalmoscope. After setting the ophthalmoscope for 0 diopter and using a small beam of light, darken the room. Ask the patient to look up and slightly over your shoulder at a point or an object on the wall. When examining the patient's right eye, use your right hand and your right eye and vice versa for the other eye. Start about 2 feet away from the patient and about 15 degrees lateral to their line of sight. Look through the aperture and observe the red reflex. Follow the red reflex in until the retina comes into focus and observe the retina and the optic disc and vessels. You may need to adjust the diopter if the structures are not in focus. Repeat the procedure for the patient's left eye using your left hand and your left eye.